Hello everyone. Today we will be studying about the counseling of COPD patients from the chapter Patient Counseling, Community Pharmacy and Management presented by KG Seraph lecturer, Kekewa College of Pharmacy, Nasik. So what is COPD? COPD is chronic obstructive pulmonary disease. It is a disease related to the lungs, related to the obstruction of the airway passages. COPD is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. So, it is a pulmonary disease which is related to the lungs and it is related to the inflammation or narrowing of the airway passages through the lungs. So, it is shown in the form of a diagram. The lungs, the bronchioles and alveoli are being shown in the diagram. The normal bronchus consists of the airway passages through which the air can pass through the normal bronchioles. But in case of bronchitis, if there is accumulation of mucus, then there is inflammation and hence there is obstruction in the airway passage. Similarly, they have shown the picture of a normal alveoli which consists of the alveolar membranes through which the air passes. But in case of emphysema, there is breakdown of these alveolar membranes because of which it obstructs the passage of air. So this is related to the condition in COPD, condition of the lungs or the airway passages in case of chronic obstructive pulmonary disease. The symptoms are chronic cough. Okay, there is a long term coughing for more than 4 to 5 weeks, fatigue, chest discomfort, then production of mucus, shortness of breath and dyspnea. These are the common symptoms of COPD. Then what are the non-medication measures which should be taken for COPD patient? Pharmacists should advise and educate the patients on dosage, treatment, expectations and the importance of adherence. Pharmacists should motivate the patients to follow the prescribed medicines and the directions given by the doctor as well as the pharmacist. Instruct patient to stop smoking and also provide nicotine replacement advice. So smoking should be stopped immediately. Encourage patients with long-term COPD to receive a yearly flu vaccination. So if yearly flu vaccination is given, the chances of COPD becomes less. Demonstrate the use of inhalers. Mostly the COPD patients have to use the inhalers to clear the airway passages. So how to use the inhalers, they should be guided. Provide support using self-management plans. Okay, if the patient is educated about the disease, he will be aware about the treatment and the precautions or preventions to be taken so that he can self manage the disease on his own. Provide advice on lifestyle adaptations such as diet, nutrition and exercise. So adapting a diet or a balanced diet, nutrition and exercise will help to combat COPD disease. Make patients aware of significance of air quality. So patients should avoid places where there is lot of pollution or allergens. So these are the non-medication measures that the pharmacist should advise. Now regarding medication treatment, if levobuterol is prescribed, the patient should be counseled that the prescribed dose should be taken as the prescribed by the doctor and its frequency should be according to the prescribed directions. Do not change the dose unless the doctor instructs to do so. In case of corticosteroids, inform about the side effects like sore throat, cough, mouth infections, etc. Also, while after using the inhaler, gargles should be done with the mouth. Gargle the mouth with water. Okay, there is also a risk of pneumonia for those who are using the long-term use of inhaled steroids. If methyl xanthines are prescribed, then instruct not to discontinue taking this medication on initial side effects. Inform to avoid caffeine containing beverages with this medication. Now in case of azithromycin, instruct the patient to take this tablet regularly and avoid use of antacids, aluminum containing antacids. Advise patient to immediately report the symptoms of hepatotoxicity. and the medicine should be taken on an empty stomach. If ciprofloxacin is prescribed, instruct the patient to report symptoms of tendinitis or tendon rupture. If there is, if elder, they are using concomitant steroids. Advise patient to use sunscreen, avoid tanning beds and avoid excessive exposure to sunlight, as this drug may cause phototoxicity. So this was related to the medication or the counseling regarding the medications. Thank you so much.